Hello and welcome to Community Health Journal. We begin today with an up-close look at a hospital's intensive care unit. At Catholic Regional Medical Center, it's a brand new ICU, incorporating the ideas of a large number of Catholic team members. That collective input has produced an ICU that puts the patient and family at the center of focus for the hospital staff. From the outdoor rooftop garden where ICU patients can get a respite from their hospital stay, to the lean principles used in the design, the work that went into this critical care unit and the finished product show a laser focus on one overriding goal: create the best healing environment possible for the patient. The design work on this unit began more than 2.5 years before it welcomed its first patient.
I think what sets the unit apart is that for the entire 2.5 years, we had staff involvement at every level. And so the focus was always, when we needed to make hard business decisions, what was good for the patients, what was good for the families, and what would make the staff space the most usable. And I think we managed to carry that out. So while it is a very high-tech space with all sorts of equipment, it's also a very soft space that really focused on the needs of a patient and their family.
The design team, which included nurses, doctors, therapists, social workers, and former patients, spent 3 days in a warehouse designing the new ICU using cardboard cutouts to make sure every consideration was given to ensure a highly functional unit.
It goes back to the lean principle. You want your supplies and equipment at the bedside. You want to decrease the steps of the nurses that having to take to go get those things. A lot of our supplies and equipment are very close to the patients. We designed the unit so we have supplies on either end when we need to restock or get things. So decreasing steps allows our nurses to be at the bedside where they want to be.
It's one thing to design it and to plan it, to see it in a drawing, but then to see it come to form and to actually see a patient and to be able to treat patients within that environment. It's pretty amazing.
A quiet healing environment is critical for ICU patients. Sound-decreasing ceiling tiles and special flooring are designed to limit unwanted noise. Patient rooms are large and consist of 3 zones identified by changes in the flooring. Staff, patient, and family space are all designed to enhance the patient experience.
We truly believe that the families are part of the care team, and our community member on the design team really had us focus on what families needed when they were at the bedside for several days. And so we have large bathrooms where family members can shower right at the room. We have a couch that turns into a bed. We have a fridge so family members can bring their own snacks and drinks. We have USB ports, and we have workspace for them so that if they're going to be here for long hours, they can continue with their daily life.
A sleep room is available on the unit if a family member needs a quiet space to get away. Patients can activate the blinds and the lights from the call system. Full bathrooms are at the foot of the bed so that the fall risk for the patient is decreased. Beds are positioned so that the patients can see out of the large windows and still view the TV and care boards. Visitor space consists of 2 separate waiting areas plus a nutrition center where families can have meals or grab a cup of coffee. These spaces enable multiple families to gather without feeling they are imposing on each other. All 3 rooms have large windows to allow in natural light. 2 small rooms are available for family care conferences, and there is a sizable conference room for larger families or for the staff to use for classes and meetings. One of the unit's most unique features is a physical therapy gym focused on early mobility. It includes an exercise bike, parallel bars, and a large mirror to help the patient visualize their progress.
In the old ICU, when we didn't have the capability of having the gym, we were pretty much confined many times to what we could do in the room, what equipment we could bring in the room. But now we have a site where we have some equipment where if the patient is stable to do so, we can bring them out into the gym. And also psychologically, I think it's good for the patients to get them out of their room in a different environment.
Each room has a 500-pound ceiling lift, dialysis access, and booms that can be moved for patient care needs or raised up and out of the way when not needed. The staff workspace is near the patient door. It includes a pass-through cupboard that allows for garbage and dirty linen to be pulled from the room without disturbing patients, or make environmental services staff put on gowns to enter isolation rooms. A linen and supply cupboard can also be stocked from outside the room, which decreases aid time for stocking and allows for a quiet environment for the patient.
It's paramount to patient safety because you're in the room with the patient, and if something is going on in the ICU environment where you need things quickly and urgently, it's there for you. It's organized, it's stocked, it's there, and the nurse does not have to leave the room to get those things.
Between rooms are nurse workstations with large windows where staff can chart and still be able to monitor their patients. These charting spaces were built large enough for students to be able to learn side by side with the nurse. Offices are available at either end of the unit, so patient room flow is not disturbed. The social worker's office is located in the visitor area to encourage family interaction. At the back of the unit are manager and intensivist offices that allow for report and dictation. This space also has a sleeper couch so the doctor can rest if the night is not busy.
Throughout design, we focused on soft colors. We did a lot of artwork that was regional that staff actually did much of. So every room carries the theme of warmth and comfort throughout the unit.
Space for the caregiver staff consists of a large break room looking out over the river to provide a sense of peace and relaxation. The room has a dishwasher, garbage disposal, and ample plug-ins to allow for team meals. The locker room and built-in mailboxes give staff a place to store personal items. A respite room is separate from the staff lounge, so moms can breast pump, or a caregiver who's gone through a traumatic case can get away for some quiet reflection.
What sets our unit apart is how we were able to integrate our staff space, our family space, and our patient space. It works, it flows, and we're very proud of it.
Patient comfort extends outside too. A terrace garden offers caregivers the chance to take patients outdoors, to breathe fresh air and soak up the sunshine, all with the goal of healing.